to regain your energy. Do I hear any looking to regain their energy? Okay. Maybe even, you know, your drive. Okay, but lose your but you want to lose your irritability and anxiety. Hormone balance might be the answer you're looking for. With SottoPelle, Texas, please welcome Dr. along with one of his success stories, Kaylin Young. Hi. All right, a lot of people are hearing things about hormone therapy, but not quite understanding what we mean by that. And what we've kind of come back to realize in medicine is indicating a bunch of symptoms, we need to look at what the problem is and restore what the body's lost.
Well, that's right. You know, in the past, we had like one therapy for everybody. There were side effects. We weren't really treating the whole patient. Lots of patients have problems with memory, irritability, anxiety, depression, sex drive, weight gain across the midsection. They don't sleep well, so they get sleeping pills, they get antidepressants, they get pills to help them have better memory. But the fact of the matter is, it's all about hormone balance.
Yeah, and we call symptoms that you said, we usually call that aging, right? And so people go, okay, now I get what my parents were talking about. And in a sense, aging is the diminishing of hormones. That's one of the signs.
Well, that's right. You know, women start losing their testosterone 10 to 15 years before menopause. It could be in their late 20s or early 30s. So they don't feel well, their energy level's down, they don't sleep well.
Yeah.
And
okay,
yet
I'm going to stop you right there because you said testosterone, and I know there are a lot of people out there who go, women, testosterone, really?
Make a lot of testosterone every day.
Yeah.
And it's a very important hormone for all the reasons that I mentioned, and yet they go out and they get put on antidepressants, they get put on other things. No one ever looks at their testosterone. That may leave 10 to 15 years before their estrogen stops at menopause. So this long period in the perimenopause is very important to make women feel good again and regain their life, and it's possible. And
testosterone even impacts your immune system, so lots of problems kind of have this domino effect. How were you feeling, and was it a gradual moment or something that one day you woke up and said, I feel like a ton of bricks have hit me?
Well, I had already been fighting low thyroid anyway, so I was on thyroid medicine, so I knew what those symptoms were.
Right.
But the highs and lows, the unbalanced, irritable, just lost my mojo. You know, I just wasn't myself anymore, and I had gone through menopause. And I started doing some natural bioidentical hormones, the creams and stuff, and for about a year, and nothing ever worked. Yeah. And I was just tired of it, and I just...
What were doctors telling you when you said, okay, I don't feel right?
Okay, well, you know, I'd done my lab work. Okay, well, you know, your thyroid, okay, I've got my thyroid fixed. Yeah. And they go with the creams. You just got to keep putting them on 2 or 3 times a day, and they're expensive. And I'm like, are you kidding me? They're not doing anything. I'm still high and low. I'm anxious. I'm
on,
and I don't have my...
Doing some...
I said, come on here, what's going on?
All right, Dr. Donovitz, you certainly know the technology behind all of that, and there's some valid points to some of those things, but you're kind of the next generation, if you will, by using the pellet. Explain what that is, and explain what you did for her that changed.
Right, so what we did was we actually looked at her lab work and found out where the deficiencies were. And what we can do is individualized therapy. We have little pellets, they're about the size of a grain of rice, or actually small grain of rice, particularly the estrogen's about 1/8 of a grain of rice. And we actually can dose it so that we can correct estrogen deficiency, testosterone deficiency, and we can individualize it. Not every patient gets the same dose. Not every patient needs both hormones. So by matching her to the hormones to what her symptoms are, we can actually get rid of them. And we get people off of their medicines. They don't need their antidepressants. They don't need to be on Lipitor and Crestor because their triglycerides and cholesterol will come down once their hormones balance. And they lose weight. If you want to lose weight, you got to balance your hormones. Otherwise, you can go on diets, all these diets, exercise, you won't lose the weight, and it's so frustrating.
Yeah, all those other symptoms were the body saying something's wrong. It's the body's warning system. And so what we do with a lot of medicine sometimes is we try to quiet the warning system. Just because you shut it up doesn't mean the problem went away. And so this is addressing the problem. Okay, so it's about the size of a grain of rice, and you place it where?
It's painlessly placed in the hip, just under the skin, and you only have to do it a couple times a year. So instead of putting cream on, as Kaylin said, 3 times a day, 2 times a day, it's not working. These, not only do we put them in and it doesn't hurt, you only do it every 5 months. We get lab work to make sure you're in perfect balance afterwards, so it's not only guesswork. It's not like here's a pellet, here's a pill, here's this, see you at your pap smear. We don't do that. I mean, we treat males and females, both, so we make sure they're in balance. A lot of them have the same symptoms, and it's so much better when you can find out that, yeah, you're in balance now and your symptoms have gone away. It's the testimonials from the people. The people regain their life. That's the whole deal.
Okay. have a piece of pork tenderloin stuff right here. But all right, so tell me feel today and how long before you saw a difference?
I saw it immediately because, like I said, and Dr. Donovitz also takes care of my thyroid too, so I get to go in there and do that. But the time release was everything. It wasn't this up and down. It was real smooth. I, felt probably 2 weeks. 2 weeks in, and then it just got even better and better. And I tell you what, I am so fun and frisky now. I am so into this. I'll never not do it.
Well,
Ever.
it's funny because you'll have, I mean, the last time you were here and you had some clients, they said, I feel like my old self, as in the previous, right before things started going downhill. I feel like I did when I was in my 20s.
Oh, yeah, I do.
She's like, oh,
great.
yeah.
You gotta do it.
Right. Also, the last time you were here, you had your office up in Dallas. Your office here was not open yet. You were one of the ones that was taking a road trip to Dallas because you needed to get well.
In the same day.
Yeah.
Oh,
yeah. And now...
Right, well, we have so many Houston and surrounding area clients that ask me to come down. So I have an office here, and it's over by Rice University, so it's really not. And people can come every month, because I'm here every month now, and I come in for 2 or 3 days a month and take care of everybody. My office up there is still there, and we take the phone calls every day. So because you're only getting them twice a year, it's not a real problem.
Right.
So now I'm here for the and it's just much better. They can see me instead of having to drive.
Wow. Okay, so the symptoms that we mentioned earlier, the whole thing where people might say you're just aging, right? And it can happen at different times, not only when you're older, but sometimes after women have had babies. There's kind of that baby blue thing, your body kind of shifts. You take a thyroid hit, estrogen, progesterone levels off. So it can also be, I guess the key to listen to is not if you've just been through menopause or something, but are you not feeling right?
Well, that's right. As you age and you lose hormones, all these symptoms occur, but no one looks at your lab work where your testosterone is, where your estrogen is. You might have had a hysterectomy and you still have your ovaries, but maybe the ovaries aren't working and no one's looking at that. So if you don't look at that and try to figure out where your balance point is, a lot of other things go wrong. And a more important point is, and Deborah hasn't really mentioned the long term, but if you look at long term, you need your hormones. Estrogen has 400 functions in your body. Testosterone has hundreds of functions in your body. Long term, decreased risk of Alzheimer's, increased risk of osteoporosis. In fact, testosterone is the one hormone that protects the heart in both men and women. It increases blood flow to the coronaries. It decreases plaques, even if you already have plaques. So people with angina and heart disease, you can take hormones. You've been told in the past, oh, you can't have hormones because they cause blood clots. With pellets, you have no increased risk in heart attack, no increased risk in stroke, no increased risk in blood clots, and better yet for the women, no increased risk in breast cancer. In fact, there's
Right, that's so important. And I'm going to wrap up with the fact that I can't tell you how many times people have said to me, and I say, it sounds like, and they said, no, we've been tested, I'm within the range.
Yeah.
But the key is, whose range is this? If you were here before and now you're here, your body notices that shift in hormones. Your body will notice it, and so you don't diagnose off of you're within a range. You diagnose of the symptoms and how you feel and what the body is telling you.
That's right. The loss of hormones is a clinical diagnosis. There actually is no normal range for testosterone in women and or men. Why is that? Because everyone's different. You're one age. You're another age, everybody's different sizes. So what you see on the lab slip is expected range because there is no normal range. So you have to know how to interpret the lab work, which you don't get in residency training. You have to be specialist, expert trained to do that. That's what we do. And it's all about the dosing because you can vary the dosing based on the clinical symptoms. It's a clinical diagnosis. You can go in and you tell your doctor, I don't feel right, and he goes, well, I got your labs right here. Normal to me.
Your labs tell me you feel right. Too bad. Right?
Yeah.
All right. Well, congratulations on feeling
Thank you.
Yes. Dr. Donovitz, thank you. As we mentioned, Dr. Donovitz has an office in Houston now. You can schedule your appointment by calling 713-533-9292, 713-533-9292, or log on to SottoPelleTexas.com, SottoPelleTexas.com. Thanks again.
Thanks.
Coming up, you've seen the stories, people who've lost hundreds of pounds with bariatric surgery, but is it right for everyone?